Hi, I am Dr. Bhavana Girish, Fertility Specialist at Motherhood Hospital, Banshankari and Indiranagar. Today I was asked to share a story about a patient that was special to me, and it was very difficult for me to choose one because honestly I think as a fertility specialist every patient is special to us and everyone has a story that is so touching and so memorable. But today I have chosen to speak about Mrs. A, let's call her. She has been an inspiration to me in so many ways. She came to me aged about 34 with an AMH of 0.2. She had been to multiple fertility doctors in the past, many of whom had advised her to go for a donor egg because she barely had any follicles, about one or two on each ovary. And she was just not ready to accept that this was the end of the road for her. She came to me and in her very first consultation, sometimes it just clicks between the doctor and the patient, and that's how I felt, and apparently that's how she felt as well. So I told her that look, we'll go ahead with your own eggs. Be mentally prepared that it may not happen, it may not happen in the first cycle, you may need multiple cycles, you may need embryo pooling. And with open arms, she said, Doctor, whatever you feel is the right decision, go ahead. That is the sort of faith that she put in me from the very first visit. And we stimulated her in the first attempt. We got just one single oocyte, which by God's grace grew into a beautiful 4AA blastocyst. I froze that and we decided to go for a second cycle to do an embryo pooling. In the second cycle, unfortunately, the egg quality was not great. Again, we got just one single oocyte, but that embryo did not grow past the third day and it arrested. So we decided to go ahead with the transfer of the single embryo that we had from the first cycle. And even during the transfer cycle, I was a little hesitant. Should we go for an endometrial receptivity testing? Should we go for a genetic testing of the embryo? And throughout the process, she was like, no, I have faith. This is it for me. This is going to work out. And the transfer went smoothly, but honestly, my expectations were not so high. The numbers are stacked against us, at that age and at that AMH. The chance for success is at best about 30%. The day she was due for the beta HCG, I think I was honestly a little more anxious than her. I actually called her up and said, did you get the report? And she said, no, I'm still waiting for it. I said, yes, me too. And the minute she got the report, she called me and I couldn't believe my eyes. I'm like, are you sure this is the correct report? Is this yours? And she said, yes, I told you it would happen. And my takeaway from this is sometimes the positivity of the patient rubs off on us. And in this particular case, her positivity, I honestly believe, was what made her go for it. She is having an ongoing pregnancy, everything's going well. I think she's about 7 months pregnant. And I use this as a story whenever patients come to me who don't have a lot of hope and say, I don't think it's going to happen. I say, see, if it happened for her, it's going to happen for you. You have to believe it more than me even. So that's it. Yeah. Thank you.